Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Can adults get RSV? Respiratory syncytial virus, RSV, is an infection that can be passed from children to adults. While most healthy adults with RSV infection usually can be treated at home, older infected adults may be hospitalized if they require additional medical support for breathing, eating, and drinking. This is true for infants younger than 6 months old, as well. /r/n/r/n Find out more about RSV in adults, including RSV complications, how long you are contagious with RSV, your treatment options, and how to protect high-risk, vulnerable adults from RSV. /r/n/r/n West End 61, Getty Images /r/n/r/n Adults can get RSV after being exposed to the virus causing the infection. This viral transmission of RSV can occur when /r/n/r/n If you're not sure whether your symptoms are RSV or a cold, testing can be done to confirm the virus responsible. However, your healthcare provider may make a diagnosis of RSV based on your symptoms and medical history alone. If testing does occur, it is typically done with a nasal swab to check for signs of viral activity. /r/n/r/n If you want to know if you have an RSV infection as an adult, you can get an at-home testing kit without a prescription. These tests check for RSV, flu, and COVID-19 using one sample from a nasal swab. After you collect your sample, you'll send it to a designated lab for testing. /r/n/r/n Complications of severe RSV symptoms in high-risk adults include pneumonia. People in this group include /r/n/r/n Typically, people infected with RSV experience mild, cold-like symptoms, but this depends on their personal health history and current condition. Mild symptoms include runny nose, coughing, appetite loss, wheezing, sneezing, and fever. Serious symptoms lead some to wonder if RSV is deadly. There are cases in which RSV infection has progressed to serious lung infections and pneumonia, which can cause death. /r/n/r/n Having an RSV infection can make existing chronic conditions worse, including the following: /r/n/r/n Complications of severe RSV in high-risk adults can be dangerous and may require hospitalization. /r/n/r/n/r/n Bear in mind that a mild infection for healthy adults can be potentially deadly for someone who is at high risk. Some 60,000,160,000 older adults in the United States are hospitalized each year due to RSV infection, and an estimated 6,000,100,000 of them die due to complications of RSV infection. /r/n/r/n When infected with RSV, you usually are contagious for 3 to 8 days after symptoms start. However, you can be contagious up to a day or two before showing symptoms. High-risk and vulnerable people can remain contagious for up to 4 weeks after symptoms resolve. /r/n/r/n Most cases of RSV in adults will resolve independently without treatment within a week or two. Use over-the-counter, OTC, pain medications or fever red. Uses for RSV symptom management. Adults hospitalized with RSV infection will receive additional treatment. /r/n/r/n Treatment for severe RSV in adults ensures the patient can breathe, drink, and eat adequately and safely. These treatments can include /r/n/r/n The Food and Drug Administration, FDA, has approved 3 vaccines to prevent lower respiratory tract disease, LRTD, caused by RSV. Arexvy is approved for individuals aged 50 and older, while Abrysvo and mResvia are approved for those aged 60 and older. /r/n/r/n Additionally, Abrysvo is approved for use in people aged 18 to 59 who are at increased risk of LRTD caused by RSV. All 3 vaccines are administered as a single injection and are recommended for adults over 75 and for those aged 60 to 74 who have certain risk factors. /r/n/r/n There are other steps you can take to help protect high-risk adults in your family and community. These methods of protection are geared towards reducing the risk of spreading viral infection. /r/n/r/n Ways to prevent the spread of RSV infection and help reduce risk to high-risk adults include /r/n/r/n The FDA has approved 3 RSV vaccines for preventing LRTD, Arexvy for those aged 50 and older, and Abrysvo and mResvia for those aged 60 and older. Abrysvo is also approved for individuals aged 18 to 59 at increased risk. Arexvy and Abrysvo may increase the risk of developing Guillain-Barr Syndrome GBS after the vaccine has been administered. /r/n/r/n Infection can be passed to adults and cause symptoms ranging from mild to severe. RSV is contagious for several days after symptoms start, but in persons with reduced immune system functioning, the illness can still be spread for some weeks after symptoms resolve. Older adults and adults with compromised immune systems or coexisting health conditions like asthma or heart disease are considered vulnerable to infection and health complications from RSV. /r/n/r/n You can test for RSV at home or at a healthcare provider's office. Treatment beyond OTC therapies usually is not necessary, unless in severe cases in which hospitalization is required to help a person breathe, eat, or get fluids. Vaccination is recommended for all adults over age 75 and those over age 60 with certain risk factors. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.